Okay, so to perform a sterile dressing change for an incision, a primary incision, what I would do is I would first go and verify the physician's orders, and then I would go and gather all of my supplies. So I would go get my supplies, which is a sterile dressing change kit and some sterile saline. So I go into the patient's room. I would ask them to state their name and date of birth, and I would compare that to their wristband to verify their identification. Once I do that, I would perform hand hygiene, and I would put on some clean gloves. And then once I got my clean gloves on, I would go over to the patient and I would remove their previous dressing. There's not one on right now, but I would remove their dressing, and then I would put that into the biohazard bag. Once I do that, I would take my clean gloves that I had and I would take them off and put them into the biohazard bag as well, and I would perform hand hygiene again. Then I would take my sterile kit and I would open it away from my body, and then I would take my sterile field right here, and I would be careful not to touch anything but the outside edges, and I would place it here, because anything on an inch around the outside edges is not sterile. And then I would take my sterile tray and I would pick it up from the bottom, making sure not to touch anything on the inside. I would carefully place everything inside the sterile field. Okay, got that. Then I would place this here. Then before I put on my sterile gloves or anything, I would take my sterile saline, I would open up the cap, and I would pour just a little bit out to make sure that the area around the top is sterile. And then I would take it and I would pour some into my container if it is waterproof. And after that, I would take my sterile gloves right here, making sure not to touch anything else on the inside of my sterile field. And I'm going to move this over so I'll have room. And I would open these, and I can touch the outside of the packet right here because that's not going to be sterile. I would throw this away. I would open it up carefully, making sure not to throw the gloves across the room. And make sure that my packet remains open. Then I'm going to take and put on my sterile gloves. So I can touch the outside right here where it's folded, making sure these gloves are a little small. Yeah, these are too small. Making sure not to touch the outside. I can roll a little bit. Okay, now I can touch anything with this hand. These are old and small. So then I would make sure not to touch the outside there. Okay, now I can adjust this glove as well with this hand since it's sterile. So now that I have my sterile gloves on, I can touch anything in my sterile field. So then I would take a couple of my gauze and I would put them into the sterile dressing. Make sure that they're saturated with the sterile sterile saline. And then I would take it and I would take one of them, I would take one of my gauze, and I would go over to the patient and I would do one swipe with the gauze and then discard. So I would go from cleanest to dirtiest, which means that I would go from the middle of the incision and discard, and then take another one and I would go on the outside around, one swipe, discard, and then for good measure I'll do one more. I'll go one more swipe and discard. And then after that, what I would do is I would take a dry gauze, and I would do the same thing with the same pattern. I would go from cleanest to dirtiest. So I would go with the clean, or with the sterile dry gauze. I would dry it middle, and then I would discard after one swipe. Then I would do the outside, discard again after one swipe, and then take one more, and I would swipe and discard. So once I've done that, what I'll do next is I will take my sterile dressing, or sterile gauze, or an ABD pad if needed, if the wound was big enough. And I would take it and I would apply the sterile gauze to the site, and then I would take some tape, or like Tegaderm, to make sure that everything is secure and that it's not going to come off, and I would apply it to the site. Then I would take my gloves, I would take them off, and I would perform hand hygiene, and then I would go and document how the procedure went, how the patient tolerated it. I would document what the site looked like, if it's clean, dry, and intact, or if there is any redness or swelling or any purulent drainage coming from the incision site, and anything that it indicates any type of circulation issues, or if it indicates any infection issues. And I would throw all of my stuff away, and then that would be it.